Okay, so here we are. We're going to check what we call a functional leg check. We're going to pump, stimulating the sacral pump. We pump that nervous system. We pump it from the boot in the sacrum. We're going to pump it. We're going to pump, and that's going to stimulate the defensive mechanism. And what we're going to do is we're going to get a reading. As we're pumping, it's not a static leg check, it's a dynamic functional leg check. Turn your head to the left. The patient turns their head to the left and you can see she goes even. Take a deep breath. The breath activates the breathing mechanism. The breath is what stimulates that cerebrospinal fluid. And just by doing this, we're going to find we're activating the defensive mechanism of the body. The defensive mechanism is triggered through the hamstrings, and we're going to find this beautiful little pumping action. And we're going to find the movement. Remember down here, we want to look for the parasympathetics, S2, and then we check L5. L5 will rotate to the short leg side. We're also going to find the piriformis. The piriformis muscle will contract on that short leg side. The L5 always rotates into the acute angle. Then we go on the obtuse angle, and the obtuse angle at the stress vertebra L3, and you can feel that that doesn't feel as functional as it should. Then we come to the transitional zone, and we're looking for, remember the diaphragm is connected through the phrenic nerve, which is her lower angle. Her upper angle is on the suboccipital atlas on the left laterality. Then we come to the apex. The apex, T6 through T9. We look for the apex and you feel that beautiful feeling as that energy flows. Take a deep breath. We know the major already. The major is at the top, right up top here, and you're going to see, take a deep breath, always breathing and adjusting, and let it all out. There we go. Beautiful adjustment. Take a deep breath. This patient's going to have such a beautiful feeling tonight after this adjustment. We check for the trapezius fiber. That'll be the lower angle. See, and what innervates the trapezius is that spinal accessory nerve. We go to the transitional zone, and now we're closing that out. The patient's going to leave with such a beautiful feeling. We leave the SOT blocks in there as it stabilizes the pelvis. And that patient leaves with such a beautiful feeling. That alignment process has been balanced. And we check, and we check, and recheck, and then we check again. And so we'll check you on Friday.